Dear friends, we are going to see the next chapter on the same topic of erectile dysfunction, where we are going to see when do you say that one has erectile dysfunction? What are the signs and symptoms? How do you really know? This one is going to be a short one. It won't be too long because we already spoke a little bit in detail in the previous presentation. So let's see now, how do you know? When do you say that one has erectile dysfunction? Let's see it in short by answering this question. How do you know? When do you say that one has erectile dysfunction? A man is in a bed with a woman. The man loves the woman, but still there is inability to attain erection. Or erection is there, but it is not enough for the performance. And the problem is there for more than 3 months. Then you must start thinking of impotency, erectile dysfunction. Investigations need to start. The penis that's supposed to erect and go up for sexual intercourse to take place, it is constantly down. That can be a serious sign of erectile dysfunction. You need to check history. You just don't say, it's just, it is there. Sometimes the problem might be in the background that can be addressed. Then now you know that was a problem. However, when you check the background of this problem, you realize that there is psychological issues, like what we saw in the causes and the predisposing factors in the previous presentation. So neurological, we saw them. If you know there was a trauma or operation or nerves, those wires which help with electricity. These two, neurological and vascular, are the main reasons. So if now you check the background, you check history, and you find that there was this problem, then you know this erectile dysfunction because the history is positive, is pointing to that. And medications, we know side effects. Say, I've been taking this type of medication for a long period of time, or there is a hormonal problem. The hormones in the body are not balanced, or there is a disease that damaged the hormones, or the man was done castration, or a disease affected the testes where the testosterone would come from. Then that's how you need to check from the history. Then the physical examination, he knows, the patient himself would know, or even the wife would confirm that. If a penis is constantly in this position in number one, whether you do whatever you can, but it doesn't go up, then that is impotency. It's one of the signs. If it is like this permanently, constantly, then that is impotence. Normally it's supposed to be like this in number 4, so that the penetration can be possible. So the frustration will be too much. It's eventually, it will affect the man himself and the woman as well. It's a problem in the couple. It's a problem, it's a serious problem. So in short, these are the signs and symptoms, or this is how you can say, somebody has erectile dysfunction. You might do tests, exams, you find it, check diseases that are responsible. You check the hormonal studies to confirm, because you cannot say a person doesn't have testosterone if you have not tested. So if you test now, you'll be confirming already what you have as the diagnosis. Thank you for this presentation. It was short, but I believe it was clear enough so that we can understand what we needed to understand.